CBS News chief medical correspondent Dr. Jon LaPook just got his first dose of the vaccine, and the cameras were there to record it. Let us check in with him now. John, good morning.
Good morning, Vlad. How are you?
Good. I'm great. First off, I want to ask you about the wave of emotions that you and other doctors, nurses, healthcare professionals have described in receiving the vaccine after serving for so many months on the front lines, watching people succumb to it and also watching people survive. How are you feeling?
First of all, I feel great. I have a little arm soreness and a little tiny bit of swelling, maybe the size of a silver dollar. But you're exactly right. I mean, I was surprised by this wave of emotion. I got really choked up and teary. And I think it was not only a relief at getting the vaccine, but a release. I mean, so many of us have been under all this pressure for so many months. I mean, for me, I was on the COVID wards back in April at NYU Langone Health, where I'm a professor of medicine. And of course, my clinical practice and answering people's questions. And then, of course, doing this job as medical correspondent. But we all have our own pressures. And I think it's going to be so important for us going forward to understand that we have an entire nation that's been under a ton of pressure. There may be some degree, there will be some degree of PTSD. And I think about the kids and the ACEs, you know, the adverse childhood events, an entire generation of kids who had a year disruption.
You know, John, a lot of people are worried about the possible side effects, including my mom. So what are they?
You know, they're mostly the typical things for getting a shot. So I had a little arm soreness. There can be a headache. You can have a fever. There can be a little bit of swelling at the site. You can have fatigue. But mostly it goes away in a couple of days.
Dr. LaPook, a lot of people say they've been careful. They're wearing masks. They're social distancing. And you still have people end up with COVID. What do you make of that? How do you explain that?
You know, Jerika, I love that you brought that up because this virus is astoundingly infectious. And one of the problems is that people still don't have their arms around what you need to do. I would say the very biggest misconception that has led to problems, aside from not wearing a mask, people need to wear a mask, come on, is the misconception that people don't understand about the 2 to 14-day incubation period. So let's go over it one more time around the holiday seasons because it's so important. Yesterday, a patient of mine said, I got COVID tested yesterday, which was, yesterday was Wednesday, and I'm going to go to a Christmas party over the weekend. Is that okay? And I said, no, not necessarily, because with the 2 to 14-day incubation period, you could have been exposed. She could have been exposed a week ago and tested negative yesterday, but then suddenly tested positive and become infectious tomorrow, the next day, or the next day. So people have to understand that 14-day quarantine period is for a reason. You can't just fly to get a test, be negative, fly to somebody else and other part of the country, or go to your relatives or loved ones and think that you're perfectly protected. And the other thing is that people need to remember indoors, it was information that was really did not end up being correct, that if you're indoors, it's not just 6 feet. Anywhere in the room with somebody not in your protective pod, you've got to wear a mask. Because think of cigarette smoke. Imagine somebody 30 feet away who's smoking a cigarette, and you're 30 feet away from them. Can you smell the cigarette smoke? If you can, which of course you can, then you can get infected by that virus, especially over time with it accumulating, especially if there's not enough ventilation. Open the doors, crack the windows, and wear masks.
All right, Dr. Jon LaPook, thank you very much. We'll be right back.